Welcome back to the Mental Health Minute. I'm Dr. Emily Mayfield, a licensed psychologist. I want to thank you for watching this video and being a part of the Mindset Therapy family. By providing these videos, I hope to give you the information you need to become a better you and to reduce the stigma of mental health. I am invested in your change. Please consider subscribing to my channel as a way to grow the reach so that more people can be provided valuable information on their mental health. You can also turn on the notification bell to be notified of the next video when it's uploaded. I'll post a video every Tuesday and Friday, so check back soon. So for today's video, I'm going to try to demystify the mental health diagnosis process, discuss how a diagnosis is made, and why diagnoses are even given. Also, stick around to the end to hear the tip of the day. These are quick tips on ways that you can start to improve your overall mental and emotional functioning. So let's jump in and discuss mental health diagnoses. Deciding whether mental health treatment is right for you can be a difficult decision. Stigmas remain related to mental health topics, such as receiving treatment and getting a mental health diagnosis. Mental health related topics are often not openly discussed, further perpetuating the stigma. People might conduct web searches, talk to friends, or make an appointment to talk with their primary care doctor, but they don't usually experience a negative mood, poor behaviors, or physical complaints and come to the initial conclusion that they have a mental health disorder. After talking with friends and professionals, the recommendation may be for them to consider a therapist and consider their mental health as a possible cause for the symptoms. Oftentimes, people are concerned that if they do seek therapy, they'll be given a mental health diagnosis. Despite mental health being more frequently discussed in public forums in the last several years, there is still a fear associated with receiving the label for a mental health disorder. First, let's discuss what mental health disorders are. Mental health disorders are conditions that impact your mental health through your thoughts, moods, and behaviors. Everyone has days, weeks, or even months in which they don't feel like themselves and think and behave in ways that are different from their normal functioning. This is normal and nothing to be concerned about. Life stressors happen, and it's appropriate to experience moments of difficulty in your life. A mental health condition develops into a mental health disorder when the symptoms cause significant impairment in your ability to function in social, occupational, or other important areas of your life. Depending on the mental health condition, this significant impairment must occur for a minimum period, often at least 2 weeks. If there's not a significant impairment in your functioning, then you do not meet the criteria for mental health disorder. This important piece of information is to highlight that everyone at some point will experience tough periods. But if they're effectively managing them, then it doesn't result in a mental health diagnosis. Awareness of the individual's culture is also important when considering a possible mental health disorder. A culturally appropriate response to a stressor does not lead to a mental health disorder diagnosis. For example, in some cultures it's common to talk to those who have passed. If this behavior is culturally acceptable, it would not be appropriate to make a diagnosis. Mental health disorders are diagnosed by professionals that are trained in mental health conditions. This can include primary care doctors, psychologists, social workers, counselors, and psychiatrists. Each of these specialties have training in the various mental health disorders and how they impact someone's life. If you are experiencing symptoms that could suggest mental illness, you will be evaluated by the professional. They'll gather information on your current symptoms, how they've impacted your life, and the length of time the symptoms have been present. From this information, the professional will consider whether your symptoms meet the criteria for mental health diagnosis. Mental health disorders fall into several categories. According to the Diagnostic and Statistical Manual of Mental Disorders 5th edition, or DSM-5, there are 19 categories of mental health disorders. The DSM-5 is a classification system that separates mental illness into categories based on the symptoms and the course of the condition. Some of the common categories include depressive disorders, anxiety disorders, obsessive-compulsive disorders, bipolar disorders, trauma disorders, and personality disorders. Not everyone who presents to mental health treatment will be given a mental health diagnosis. If you're concerned about receiving a mental health diagnosis, it's best to go to therapy sooner versus later, before your symptoms develop into a disorder. As a reminder, you meet the criteria for a mental health disorder when there is a significant impairment in your social, occupational, or other important areas of functioning. Now that we've discussed what a mental health disorder is, let's discuss why mental health diagnoses even exist. So mental health diagnoses help the professional determine prognosis, treatment planning, and possible treatment outcomes for the individual. Many mental health treatments have undergone extensive research to determine how they best treat the various mental health disorders. If you are appropriately assessed by a professional and given a diagnosis that accurately captures your symptoms, then an evidence-based treatment can be utilized to help you meet your treatment goals. This will ensure your success in overcoming your mental health symptoms. Receiving a mental health diagnosis should not be viewed as a label that you're given. The name of the disorder is meant to assist the professional in developing a treatment plan appropriate for you, so that you can learn tools to better function emotionally, mentally, and physically. Taking the first step to be evaluated is often the hardest, but it will be the first step to finding a plan that will help you get to a better place mentally and emotionally. So now for today's tip of the day. Take small steps. When we recognize a change we want to make, we often dive head first and start making big plans for how we'll meet the goal. Being motivated is great. However, if you set your goals too high or expect too much too fast, you might find yourself falling short and feeling discouraged. Take small steps on the road to change. The path from A to Z will look very different in the future compared to how it looks now. Know what your end goal is, but set up small steps on how to get there. You can visit our blog linked below for more information on mental health diagnoses, and check out one of our other mental health minutes. I look forward to seeing you next time. Have a good day.